Hello, everyone. This is Dr. Cross, and this is my introductory video for social work and healthcare settings, part one. Um, I wanted to introduce myself to you all in this course just to give you an idea of what my background is in terms of medical social work. Social work and healthcare settings is a very important course for me, and I'm very passionate about this course because most of my work in the field was actually in social work and medical social work specifically. To give you a little bit about my background, I consider myself a social worker first. I identify as a medical social worker, and my specialty is perinatal social work. Perinatal social work is a form of maternal child health in that it deals with women who are pregnant all the way up until they deliver, and all the way past that until when a child is at least 1 year of age. So any issues that come related to pregnancy, birthing, and motherhood up to 1 year of life is a focus for perinatal social work. I used to work for the hospital of the University of Pennsylvania in the Women's Health Service Department for 15 years. I was specifically placed in the newborn intensive care nursery. However, I worked different services in the hospital, including labor and delivery, maternity, perinatal evaluation center, OBGYN services, labor and delivery, and so forth. And so I do have a strong background. Most of my work history was in medical social work. I teach this course passionately because my goal is to increase the interest of social workers entering into medical fields. So I'm hoping after taking this course that you are excited about taking social work and healthcare settings part two, and hopefully getting you interested in medical social work. Ironically enough, I ran into an older student of mine from another university. Probably was 5 weeks ago. I was walking my dog, my puppy actually, around the park, and these little kids came running up to me. Of course, the kids saw the puppy, got really excited, and I let them play with the puppy. But as I saw the mother approaching, I asked her, was it okay if the children played with the puppy? They were already playing with the puppy, but just wanted to make sure it was okay that the mother was fine with it. She said yes. As she started approaching and my puppy was going wild, running around her children, the lady asked me, "Are you Dr. Cross? And did you teach at this other university?" And I'm like, "Yes." And I didn't know if I was so unrecognizable because I was out in my gym clothes looking probably crazy, then I was like, well, God, am I that old? It wasn't that long ago. And she had said to me that I taught her social work and healthcare class, and she remembered me. She said she couldn't recognize me because I had my hair wrapped most of the time at that time because I did the chop off during that time. And she said that she really enjoyed my classes and what she had learned, and she was currently working in a healthcare organization based in Philadelphia. It's called Esperanza. And she said that she worked specifically in the behavioral health section of that department, but she was also interested in moving on through the different health branches of that organization and doing more work in the clinic. She also had mentioned that it was, hearing about my stories of working in the healthcare environment, and the type of clients and the type of services that social workers provide, learning about populations to serve, learning about the different issues and challenges that clients present, the health challenges related to overall clients and healthcare, health disparities, how she enjoyed the class so much that it really uh, um, um, lit a chord in her and a passion for medical social work, and she was practicing today as a medical social worker. And I was so happy. That's like the most rewarding thing a student can say is that they heard you, things that you said to them during courses resonated with them, and it helped shape their career trajectory into medical social work. And so my goal with this class is not to turn you all into medical social workers, but just plant the seed of interest as a possible area of work for you. And I say that because you continue to grow and learn. And I'm hoping that this course will set the foundation. So I worked 15 years. I'm in medical social work, and then I went on to uh, be on the board for a couple of healthcare associations. I'm on the board for the National Perinatal Association, and I'm on the board of directors for the National Association of Perinatal Social Workers, NAPSW. I was the former president of the National Association of Perinatal Social Workers. I served as a president for 4 years, and now my official role is former president of that organization. If you have an opportunity, please consider joining any organization. I tell any career students the best way to help get you acclimated to social work and to really start building your social work career network, even as an early career student, is to join a professional organization. We have several of them, and they're listed on our course website, or through the weeks you'll become more familiar with them. National Association of Social Workers is the largest NASW, but if you know there's a specific focus or specialty you want to go into, like mine was perinatal, and so I found a professional group that speaks specifically to the work that I was doing at that time. So think of a general one that you may want to engage in, and then also think of one that will focus more on your specialty if there's a specialty of interest that you're aware about now. The good thing about doing that is you do it when there's a student discount. Most organizations offer some kind of student discount, and this is the best way to sample and see what all an organization has to offer and how it can grow you in your career. It's best to do that now at the student discount. This is the only time in your career you'll probably ever have a discount on a professional organization. So definitely think about doing that now and sample the ones that you like, because at that point you're paying full price and you don't want to pay full price just to sample. Um, so anyway, that continued to grow me. So once I found my niche, my passion, population that I work most passionately is in. Today I do my research and publications in maternal child health because of my practice experience as a medical social worker working with a specific population. But I say all that to say is that it has turned from more of a direct practice work for me to using that direct practice to inform my research and my publication and in macro work. And so today, it was becoming a medical social worker that encouraged me to join an organization. Joining a professional organization encouraged me to start leading that organization in terms of policies and procedures in the macro. I did a postdoc fellowship at the National Association of Social Workers, their HEALS program, their Health Education and Leadership Scholarship program. So once I completed my doctorate degree, I did a 1 year postdoc in the District of Columbia with the National Association of Social Workers. This is specifically related to health policy. That opened up even more opportunities for me to visit the Hill, to talk to representatives, congressmen, and state leaders about relevant, salient health policy needs. And I oftentimes use my direct practice experience with population to help bring the social work voice to the table when discussing health policy issues and improvements to health policies. Um, I did that for 1 year. I also was able to do a congressional briefing, which used the information or a lot of the literature and things that I learned from my dissertation in the doctoral program. So I'm originally from Philadelphia. So I have my bachelor's of social work from Temple University. I have my master's in social work from Temple University. I went on to get a master's in business administration and MBA with a focus or concentration on healthcare administration from Rosemont College. Further along down my educational path, I also went back and got my doctorate in clinical social work, DSW, from University of Pennsylvania. If you have any questions about that, please feel free to pick my brain about, my experiences in schooling, education, my experience as a medical social worker, or even my experiences getting my doctorate at University of Pennsylvania. I'm more than happy to do that. I get hits often on LinkedIn from various people interested in pursuing a DSW and wanted to know what my experience has been with that. And so did a postdoc specifically in health policy. I also was able to participate in the congressional fellowship programs where I worked with a cohort of congressional fellows that were placed in different legislative offices in DC and representatives to help, again, facilitate policies related to healthcare. And so I was really fortunate to be a part of a distinguished group of scholars from all around the country that were working on the Hill at the time for policy. I ended up staying in DC and being able to cultivate those experiences and those skills that I've learned in my post-doc fellowship experience with NASW to Howard University. And so I feel very privileged to have this opportunity to continue to um, review course content with you, prepare the next generation of social workers and healthcare social workers specifically. And I think that pretty much covers it in terms of my background. Please feel free to use the virtual office hours again to ask questions specifically about the course content, but you can also use it as time to talk about me or any interests that you have. If you want to talk to me, we can set that up as well, either in the virtual office or a one-on-one a Zoom, if you like. So I'm going to then now talk a little bit about the course content, but I'm going to try to align it with the experience that I've had so that you can learn more about me as well. The first couple of weeks, I'm using the fifth edition of Schneider. I will slowly convert the content into the newer edition and start uploading the sixth edition of the Schneider textbook one. So I just thought it was easier for the transition just to start off with the material that we had available, as we know that we do have a new edition this year. So the first part of the course talks about what is public health, and it talks about the science of politics and prevention, why public health is so controversial, and the powers and responsibility of government. This is very important, and I wish I would have had this information starting off as an early career social worker. Why? Because a lot of the work that you're doing as a medical social worker in direct practice, and you may go on macro or direct practice, is you're working with directly with the client. You're working with individuals and families related to health issues. For me, it was in maternal child health, and there's a lot of issues, health issues, when you think about maternal child health. Think of gestational diabetes, think of preeclampsia, think about STDs, HIV and AIDS, substance use, NAS, neonatal abstinence syndrome. You know, a lot of issues that came to be. Substance exposed newborns, and a lot of issues, and your common issues, poverty, um, incarceration, domestic violence. And so the passion that I had for medical social work and in maternal child health is that you were able to learn a specialty, but you still did generalist social work practice. So again, you were able to use generalist practice social work skills in general because you're dealing with things like poverty, access to health insurance, but you're also able to focus specially and grow in a special area too. And so to be able to grow in those ways as a social worker, where you're bringing in generalist social work practice skills, but also learning a oftentimes complicated health system and health landscape. Being prepared about public health in general would have served me best. Understanding science, politics, and prevention would have been helpful. I actually went back and got my MBA with a focus on social work. I'm sorry, in health. So sorry. A focus on um, healthcare administration, excuse me, is because I needed to understand the politics and the controversies in government. I wanted to look at it at um, healthcare from an administrative standpoint and understanding how politics play in a meso and a macro setting is important. Understanding how politics played in healthcare as a discipline, how politics play in the hospital or healthcare setting that you're working in, and understanding how politics and state and federal government is also key. Sorry about that. I turned my ringer off. That's also important. And really understanding what public health is, what the difference is between the medical model and the public health model, and understanding how my role was more in the medical care model rather than the public health. But also understanding how that how they differ, how they align would have been very useful in my earlier work. Understanding the controversies. Understanding differences between moral and religious oppositions. Understanding the difference between individual liberties and particularly the economic impact on healthcare settings. I can tell you there are often times where I would do my work. Again, I was working more in the medical care versus public health, the larger uh, macro view or approach, is that even in the individual work I did with clients, I understood there were some clients that were open to treatments and some that were not due to religious beliefs. There were also situations and issues that we had to deal with as a larger health setting that had to deal with liberty. In terms of, for an example, that will be how do we handle situations when mothers were exposed to HIV or HIV positive and didn't want to take their medication for personal beliefs. We were concerned as healthcare teams because that unborn baby outcomes would be directly impacted by that mother choosing to take her retroviral medications during pregnancy and after, but definitely during pregnancy up until delivery, and understanding that she had liberties and rights. It was her body, and that's what she wanted to do. But we had to get legal involved because it was a complicated matter. Does she have the right to make that call when we know that um, her um, her unborn child will be potentially impacted by that decision, health wise? That increased her infant's chance of being born exposed and HIV positive. But again, understanding that prior would have probably put me better position me to have those discussions. As a social worker, I still showed up. I still had an opinion that was based on my social work standards, ethics, and principles. Understanding the client's rights, but also understanding the laws and the statutes that govern the state of Pennsylvania at that time in which the healthcare organization was located, but also understanding, each of the disciplines that I work with, and understanding that each of their disciplines, whether it be a doctor, a nurse, a pharmacist, their disciplines also gave them a lens. They also had their own standards of ethics and ways of interacting with patients that informed their decision. So we all had to get together as a team and decide what was best, and also include administration of the hospital and legal. But again, that's to give you an understanding, what were some of the challenges that we had as a dealing with a particular client. But then it's not just about the client. That's not going to be the only patient that comes to the doors having the same beliefs and religious views or personal views. And so based on that, we have to now make a decision on how to formulate policy related to this. How do we address this as an agency, and making sure that whatever policies we put in place, they are in compliance with our standards and ethics as professionals, and all professionals at the table. We have to make sure it's aligned with all of our beliefs and our ethical values and principles. But we also need to make sure those policies are are compliant with the policies and the regulations and the laws of the state, as well as keep in mind any government policies related to that as well. So again, understanding public health, populations, the challenges, personal liberties, the science behind it would have been helpful. Um, Earlier on in the first part, we also talk about key issues of public health, such as epidemiology. We talk about the branches of public health. We talk about statistics. We talk about those other biomedical branches. We talk about all the different disciplines that fall under public health. That would have been very helpful for me because even though I was starting in medicals as a medical social worker, I knew about disciplines. I didn't understand how the department and healthcare settings are divided, and who are the key people in those departments, and what were their role to the overall health. Um, um, what 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 was their role in the overall health system? understanding that those public health functions, understanding how the doctors and the other providers that I work with, how they were informed by larger public health departments and standards and rules and regulations, to understand how insurances, when they were making decisions to approve procedures, to improve uh, um, standards of care, how they were developing those policies would have been helpful for me. I learned um, being a medical social worker, and I was open to learning more, but I didn't have that foundational knowledge prior to. But again, I was very fortunate that I had a very strong, highly accomplished, highly educated team around me, and so I was able to grow and learn. And again, I was also at a teaching facility, so they used every opportunity to teach everybody that were part of the discipline or the interdisciplinary team to how we were operating macro and on a micro and meso level. So that was helpful. Also, analytical methods of public health. Again, understanding epidemiology, how statistics, how populations are impacted, how assessments are made and diagnostics made when it comes to public health issues and challenges, how policy is developed, how assurance is achieved from a public health model and standpoint. Other thing that was very important is the role of data and how we are always understanding data, how it's trending, and using that to make informed decisions on a macro and meso level. Understanding specifically the understanding of how diseases are spread based on populations, what interventions are used to reduce the spread. That was important. We saw it on a micro level because we would oftentimes have people present regularly in the hospital with communicable diseases in all departments of the hospital, and how to treat that person, how to keep that contained and from spreading across to other patients in the hospital, particularly in a population, especially vulnerable patients who have vulnerable or compromised health systems, but how to keep ourselves as healthcare workers safe in an agency. So we had policies and procedures in place. They were informed by epidemiology and public health, understanding how diseases are spread, how they're developed, what the source of them are, and that's how we help manage and control. We treat our patients, but we also keep our hospital community safe, and we keep the larger community safe because as healthcare workers exposed, we then have to enter into the communities once we leave work. And so understanding, we were doing using all types of sophisticated models to understand how populations health issues work, how to understand trends, and we would use those models oftentimes to understand what was going on around us related to public health concerns, and how do we keep the work that we do and the mission of the hospital and our individual um, missions and um, modes of practice as individual practitioners keep moving our agenda forward for patients. As a social worker, my role with the patient and in a health setting is different than what a doctor or nurses may be, or a respiratory therapist or a pharmacist. So the goal was to make sure that we all can bring the strengths of our own roles to bear on patient and policies and be able to do that effectively, and understanding how diseases work helped with that. It also helped understanding how these departments in the hospital function and how those functions um, um, played out with it, work with patients and work in the hospital, on how do we all work together. Again, so having that background and foundation prior to would have been very helpful for me as a medical social work in my understanding of things going on in the hospital and why policies were made and how they impacted patients. We're also talking about biomedical basis of public health, the conquest of infectious disease, the resurgence of infectious disease, biomedical basis of chronic diseases and genetic diseases and other inborn errors. These things are important also because oftentimes I would be in mostly all family meetings related to genetic concerns for particular patients. And oftentimes, my role as a social worker was to help the client or the patient understand what was going on from a medical standpoint. And as I was a member of the medical team, I also was able to live in two different worlds. So I have to put on my lens as a patient and a lens as a practitioner, so that when the medical team is discussing things, sometimes it's understanding that they're using language that may be too advanced, too clinical for patients to understand, and asking them to bring down the language to more layman terms for patients to understand. Oftentimes, I'm also using those generalist social work skills of interviewing, observations, and nonverbal communication to understand if and to see if clients are understanding what's going on with them and how to keep themselves safe, keep to minimize the spread, or in those aspects, how can they live the best life if it's a genetic condition that we cannot change. We may not be able to change a genetic condition, but we can educate clients related to what that genetic condition is and how it plays out. We can also use data and what we understand with about the disease from data and statistics to see what the likelihood of their outcome, or even a likelihood of passing that genetic condition on to their family. Sometimes we can go backwards and see if there are other members of a person's family that is impacted. Even though that's a micro level, micro meso view of genetics, you can also then take that knowledge and apply it broadly to populations as well. Again, understanding infectious disease is important because there were times where we would have family clients come in the hospital with infectious diseases, and really understanding how some of them, such as influenza, flu, how Ebola, how bacterial threats, respiratory threats, viral threats impacted the healthcare system, because it was coming in and out of the health system regularly due to its work with patients. How to contain that and how to educate the public and keep the public safe is also important. So that chapter or that area is important in your work. And I feel, again, the need to say it's very important to say that you're getting this information early before. These are all things that I've learned in work, but a lot of my role here is to make sure I give you content and make sure that you're competent to understanding of these areas, so that if you choose to decide to embark on a healthcare career, you're knowledgeable about it in advance and prepared. Social and behavioral factors. Do people choose their own healthcare, for example, and how health behaviors impact overall outcomes related to population health? Psychosocial factors that affect health behavior. We also will be talking about specific health challenges or health issues such as tobacco, obesity. Um, we'll also be talking about how diet, particularly poor diet and inactivity, can impact population health, um, how injuries play a role, such as traumatic brain injuries, TBIs, vehicular accidents, for example, firearm injuries, um, or how those are also public health concerns. We're going to then take a view to maternal and child health as a social problem and some of the public health issues related to maternal child health. We'll also take a view on mental health and public health, how that plays a role. And we'll also then focus on environmental issues and public health for this course. And we're also going to then take a more closer look at the differences between the medical care versus the public health model, and also then take a look into the future of public health. And so this course is going to cover a lot of material in a semester, but it'll be enough to prepare you. And I can tell you that, understanding all these sections would have better prepared me as a medical social worker. And this is material that you can constantly reference through your career. And so it's important to know all these things and how it impacts, because I can say in 15 years of working, there's not one area that this book touches that I not deal with. Understanding how vehicular accidents happen, I can tell you of situations where we had to deliver babies from pregnant women who were in vehicular accidents, and how that played out in terms of what was done in terms of the decisions that had to be made in terms of mother's health versus the child's health. and understanding just again how the larger public health implications of vehicular accidents and how we could have probably used a lot of the information that we learned as medical social workers to inform policies related to vehicular safety and larger accidents. Maternal and child health, maternally infant mortality, morbidity. We know that DC specifically has one of the highest maternal mortality rates in the country. I didn't mention this, but I do sit on the DC Maternal Mortality Review Committee, and understanding what maternal mortality, and actually experiencing it as a medical social worker in my work, my 15-year work history was important, and that work and that experience informs my work in the macro world and on the maternal review committee. So again, that chapter I can really align to important issues that are going on today in public health. Mental health, as you know, COVID-19 has really increased the amount of usage of public mental health benefits. A lot of people are dealing with COVID-19 directly or indirectly, or they're dealing with loss of jobs, or they're dealing with having to deal mentally with trauma that COVID-19 has triggered with them. And so mental health is also a big public health concern. There's also policies around that. I can tell you a lot of insurance companies are making policy changes specifically based on COVID-19. From a practitioner standpoint, they've opened up practice access and scope by allowing practitioners, particularly social workers, to be able to practice in different states. That in general, there's more to that, but that's one policy. There are a lot of insurance companies that are waiving co-pays to relieve the financial burden so that their members can seek and obtain, removing that barrier access to mental health if it's copay or deductible. And so a lot of insurance companies are actually waiving that so people can see practitioners without an additional cost. I know at least one insurance company has modified their rates to practitioners, paying them a little bit more than what they were prior being paid before, because of the influx of people getting mental health. So again, mental health is also an area that we can look at in terms of public health. There are also some policies that have occurred in the recent, I'll say, 4 or 5 years with mental health parity, in which insurance companies through Obama's administration, they have to treat mental health as serious as medical health, as physical health. And so when they're thinking about authorizing and approving treatment, they can't distinguish between high risk mental health needs, um, no different than they would a high risk physical health need. So we have seen changes in terms of macro policies and system interventions related to insurance companies related to mental health as well. Environmental issues, we talked a little bit about that in prior videos about how um, we've had a water crisis in Flint, Michigan, that would qualify as an environmental hazard. But also, when you think about that was a man-made public health disaster, but we also have non-man-made or natural public disasters. We talk about public health issues. We talk about the results of 9/11, and we also have hurricanes. We know that we've had hurricanes that have ravished certain sections of the country, seeing them evolve even currently, and how that the flooding can contaminate and water supplies, and how water is not safe to drink during those times, and how people use electricity and sanitation then becomes an issue. And again, understanding how those natural disasters also play a role in public health is also important. And again, really understanding, the difference between how the medical care model assesses, deals, intervenes, develops policy, and how a public health practitioner or the public health model views public health issues, and the need for system reforms will all be covered. And so the assignments are also meant to help you understand the key things that you need to know about public health. We talk about social work and healthcare trends. assignments, which helps you think more critically and talk about um, how far we've come along with technology and how that can aid in public health um, goals. We also talk about healthcare disparities and how that impacts it. We're looking at it from a public health standpoint, how different populations are affected and why, and what are the policies related to that. We're also going to look at health system payers, Medicaid and Medicare, and understanding their role in public health and population health. We'll also be taking a global view of medical conditions too, and understanding different medical conditions and how they impact different cultures and societies globally and how their responses to it different. You'll also be looking at how different healthcare systems in different countries are different from the United States, and maybe make suggestions or think about ways in which the United States health system can be improved based on our international partners and what we see going on in other countries in terms of how some are a lot, actually, quite a few, are more advanced than us in a lot of ways, and there are many that are not. And so understanding that is also important, and we'll cover that in this course. And another assignment will be a public service announcement, really understand what's going on with how to go about messaging health education, because that's a big key in public health, and really being able to focus a public health message with the goal of improving an outcome as well as educating a population. It will be important, and you'll have opportunity to do that as well in this course. But also, and a lot of those areas that I talked about comes from our Schneider book textbook and the units in which we'll be focusing for that. But we'll also be working in our other tech books, which is Nickman and Ebel, and we'll be talking about looking at health policy broadly. So, organization of healthcare, what's the difference between acute care, um, patient-centered medical homes, primary care, prevention, urgent care, and we'll be talking more about those different levels of care. Again, we'll also talk in that textbook about politics related to healthcare in the United States. There we're looking about costs, expenditures, life expectancy, payment sources in that. Comparative health systems abroad, how provisions and financing in those health systems differ from what you see in the United States. Again, we'll be taking a look at population health, life expectancy for certain groups, how health-related behaviors impact population health, how health ranking models are utilized to understand population health, and the effects of diets on public health. We'll also be looking at some of the systems changes in healthcare systems in the 21st century, our achievements as through technology and our achievements with policy, what things have been done at local levels of public health. Also, maybe taking a look at specific public health areas such as infant mortality and other areas. Again, we'll also be looking at health behaviors and specifically vulnerable population, the health workforce, and again, healthcare financing and costs in the Nickman textbook, quality of healthcare, healthcare management, and again, we'll take another look at health information technology and the future of healthcare delivery. Um, Understanding health behavior and vulnerable populations will serve you well as a macro, if you're focusing on macro, micro, or meso systems, because health behavior and understanding health behavior for clients or patients that you'll be working with um, is important to meet the goals of the agency that you're working for. So if you're working directly with patients, understanding health behaviors will help you be more effective as a social worker in helping that client meet their health goals and improving health outcomes for them, but also when you're writing that policy to help support clients. Or maybe working on legislation to advocate on behalf of clients related to health issues. The health workforce is important because it's very important, and you'll learn what the role of social work is in public health and healthcare. but it's not enough to understand our roles. You also have to understand all the different disciplines in which we will work, whether it's in micro, meso, or macro settings, and understanding what they bring to the table and how we can synthesize the strengths in all our disciplines to improve overall health outcomes for people. Healthcare financing, healthcare cost and value is also important to know because oftentimes it's that financing that helps us do what we need to do, and the understanding how decisions are made to finance and how um, those financing decisions and authorizations are derived from standards developed by our health departments are important, and you'll learn that in healthcare financing and healthcare costs. Also, knowing that some of main goal, particularly the United States, is how to reduce healthcare costs and how to do that when we're not really meeting benchmarks for healthcare outcomes. When you think about maternal mortality, infant mortality, there are some areas that the United States is not ranking high in at all, but yet and still we are still looking to cut back on expenses because the cost of healthcare is too high. So how do we reduce the cost but still maintain quality and in some areas extremely enhance quality of services that we're delivering? And so that we'll be talking about and looking at in this class. And also maintaining again quality care because it's that quality healthcare and how reimbursement and payment for healthcare is tied in to outcomes as a healthcare practitioner or a healthcare setting. So how now quality and outcomes are tied into actual payer reimbursement for providers and agencies. How do we manage healthcare? When you think about understanding health population, epidemiology, understanding all the disciplines of public health, how then do you manage a health system? How do you understand, create policies to help address the issues that emerge in a health system in a given year or in a given period of time? And then how then do we use health information technology to improve quality, improve outcomes for clients? How do we use information technology to comb data, understand trends in population health and in conditions and so forth? How do we advocate for people who have vulnerable health conditions? How do we improve our systems? How do we look at it today and have a vision for the future of healthcare? And that's what our Nickman textbook will be doing. So we'll be covering a lot in this course. I'm very excited about this particular semester. We have a lot to conceptualize, to think about, and I'm hoping to expand your thoughts about things going on in the current environment today. I want to, give students the opportunity to research and learn about different health issues during the course of the semester. But I also want to focus on this public health pandemic because I think this may be one of others that may come down the pike. And so, even though we'll be talking broadly about health systems and public health, a lot of what we'll be writing to, a lot of what we'll be focusing on will be how public health has responded to COVID-19. And we'll be illustrating and using examples of COVID-19 to really help illustrate points because I think we are giving a rare opportunity here to understand the content of this course in the midst of a specific pandemic. And since, as you know, this pandemic has affected all of us, even in how we're teaching and presenting this information this year, it's impacted all of our lives. And so it's really important to do a deep dive in that. And so that's a little bit about me and my background in public health. I know this is an introductory message so that you can learn more about me, but I also utilize this opportunity to go over core units and areas of content in which we'll be discussing for this course. I hope this video was helpful for you. Thanks.